vaccine, as well as how to stay healthy for yourself, for your children, as well as your family. So I want to go ahead and introduce tonight's guest speaker, Dr. Talaat. She is a vaccine expert from Johns Hopkins University School of Public Health, and she's going to share all of the information that she has for us tonight about the vaccine. Let me just go over a few things. If you have questions throughout the presentation, if you are on a computer, at the bottom of your computer, you will see an icon that has the Q&A. Feel free to click on that and type in your questions. If you are on your phone, you would have to tap on your phone so that little icon can appear. And then once you click on that, you can also type in your questions there. I will probably towards the end of Dr. Talaat's presentation, I will go ahead and address all those questions. So make sure you stick around at the end, as well as we will pick our winners for the gift card, the raffle. So thank you very much, Dr. Talaat. It is all yours. Thank you.
Thank you very much, Emily, and thank you to Desiree for the invitation to come and talk today. I think I talked maybe 6 or 8 months ago about COVID vaccines, so I'm very happy to come back and give updates on how we're doing and talk about the children's vaccines. So as you all know, COVID has been with us for almost 2 years now, and it continues to go up in cases. The United States has the most cases worldwide, with over 50 million cases in our country. Thus far, we've lost 800,000 people in the United States to COVID. I know many people have lost family members and loved ones, and I'm very sorry for your loss. It's really a huge tragedy that has swept over the entire world. There's been 270 million cases worldwide, with over 5 million deaths all over the world. The positive is that we are getting vaccines out there, and lots of people have gotten their vaccines. Worldwide, there's been 8.5 billion doses administered, which is amazing. Almost 1 billion in the last month alone. So it's very exciting. We know what the risk factors are for severe disease for COVID, and the most significant risk factor is age, as is comorbidity. So if you look at the risk for everybody has the same risk for getting infected, but the risk for hospitalizations and deaths go up with every decade of life that you are. So by the time you are in your 50s, you're 4 times as likely to be hospitalized as somebody in their 20s, and 35 times as likely to die as somebody in their 20s. And that risk just goes up so much the older you are. And so it's, it's really, our elders and people with coexisting conditions that are the most vulnerable to this disease. And even now, even with most people over the age of 65 being vaccinated, that the older adults still remain the highest risk for vaccination. So these are admissions throughout the United States by age, with the darkest blue being people over 70, then 60-year-olds, 50-year-olds, etc. And it still remains that the oldest adults still have the highest risk, although the gap between the older adults and those below them has decreased tremendously. And that's because of the vaccine has really made an effect and really allowed people to live without fear of being hospitalized or dying. We also know that people of color are disproportionately affected. Again, if you consider that, for every one case of somebody who is white or Caucasian, we have 1.1 cases in Blacks or African American individuals, and almost 2 cases in our Hispanic population for every hospitalization in a white or Caucasian person, there's almost 3 hospitalizations in Blacks or Latinx individuals. And for every death in a white person, there's 2 to 2.3 deaths in Blacks and Hispanics. And so Native Americans are also particularly vulnerable and actually have the highest rates of hospitalizations and deaths compared to other ethnic groups. Having said that, I also want to touch on variants because they've been very much in the news. So like all viruses, the SARS-CoV-2 virus, the virus that causes COVID, does mutate over time. And if the mutation gives it an advantage over the parent virus, then that mutation can become a variant. And if it spreads rapidly and causes potentially more disease, the WHO calls it a variant of concern, and it gives it a Greek name so that we can tell them apart easier than giving it a name like B.1.617.2, which is the other name for Delta. And so over the course of the 2 years of the pandemic, we have had waves that have been caused by variants. So the initial wave was the earliest strain of the COVID virus. Our spring wave, where we saw so many cases in March and April in the United States, was due to the Alpha variant, which was quickly overtaken in the summer by the Delta wave that continues today. So still in the United States, most of our hospitalizations and deaths are due to the Delta wave. But as we've heard in the news, there's a new variant that's arising that's increasing very quickly in the United States called the Omicron variant. This one is different from the others in that it did not arise, it didn't evolve from the Delta variant, but what it did is it probably evolved from a very early virus in somebody who was significantly immunocompromised, and so it was then able to fight the virus. And in that person, the virus lived for months and months, gathering mutations. And so it has many more mutations, many more differences than the other variants that are circulating. So this is just a picture of the top of the spike protein. And the spike protein is a very important protein on the virus that allows the virus to bind to our cells and invade our cells to cause disease. And it's the spike protein that our immune system recognizes most strongly. And it's the spike protein that is the backbone or the important part of all of the vaccines that we have basically anywhere in the world. And so the fact that many of these mutations happen in the spike protein, including some deletions where they actually knock out part of that protein, means that the measures that we have to treat and to prevent COVID infections, particularly our vaccines, are going to be a little bit less effective against this variant than against other variants with fewer mutations. This is just a picture of the cases in South Africa where this variant first arose, and you can see there are 3 waves that have happened in the pandemic, and that the Omicron wave, the last wave, is increasing very, very quickly, with the number of cases per day now over 20,000 in South Africa, maybe due to increased testing, but it's probably due to the fact that this virus is so much more contagious than the other viruses. In the United States, we already have the Omicron variant in 37 jurisdictions. It first appeared in the US on December, it was first detected, not appeared. It was probably in the US before then. It was first detected in the US on December 1st. And by December 15th, which was yesterday, it was in 37 states and territories. It is now about 3% of the cases that are in the United States and growing very quickly. And so, but in the next couple of weeks, it likely we'll have a sort of a double surge with Omicron and Delta, and then Omicron will likely overtake Delta as a dominant variant. So what we do know about this virus is that it is very contagious. It is probably twice as contagious, or maybe 4 times as contagious as the Delta variant, which was already significantly more contagious than the previous strain. We're seeing more cases among vaccinated individuals, although their symptoms still remain relatively mild or moderate. Unvaccinated people still remain to be at the greatest risk for severe disease, hospitalizations, and deaths. Vaccines remain the best measure to protect people and slow transmission, and I'll talk about that a little bit later. What we do not know, we think that the variant appears to cause milder disease, but we need more data. We don't know that for sure. I know that there has been at least 1 death from this variant in the UK, in the United Kingdom, a couple of days ago, but we don't know how mild, if it is more mild, that this variant, the disease that this variant causes. And we're still trying to understand how widespread it is throughout the United States. Really, the only way to prevent variants from happening is to vaccinate as many people all over the world as quickly as possible. So when we think about Omicron and vaccines, how good are the vaccines against this variant? And unfortunately, they're not as good as they were against even Delta or the earlier strain. So this is from South Africa. They think that 2 doses of the Pfizer vaccine is only about 1/3 protective against Omicron infection, down from 80% prior to that. But it's 70% effective against severe disease, hospitalizations, and deaths, which is down from 95% against the Delta. Boosters really make a difference, and the increase in antibodies from a booster should be more effective against the Omicron variant. So a 3rd dose of vaccine raises that 33% to 76% vaccine efficacy against any infection, and a much higher efficacy against hospitalizations and deaths as well. So this is another reason why it's really important to get your booster. And we know that we do, in response to the vaccines, we do develop immunity that works with T cells, not just antibodies. And we know, thankfully, it looks like, at least in the lab, that the T cell immunity that the vaccines create or stimulate still work well against Omicron. So even if you do get infected with this variant, it is likely to be milder, because there are good immune responses from T cells and other cells that will help protect you against it. We also know how to slow the spread of COVID-19. So we know that even though the vaccines may not be perfectly effective, they are our best tool at preventing infection. We know that wearing a mask will protect us, social distancing, avoided crowded places, washing our hands, and cleaning and disinfecting. I'm going to switch to talking about the vaccines now, and really say that there's been a tremendous amount of energy expended by many people all over the world, and here in the United States, to get these vaccines out and available, and the safety of them has been scrutinized like no other vaccines ever. Just today, the CDC's advisory group met to talk about it. But the vaccines, they didn't arise overnight. And it was really 20 years worth of work that went into the vaccine development that allowed these vaccines to be created so quickly. And it was a huge investment of money and resources and human resources. So everybody who was working on any vaccine anywhere in the world basically dropped everything else that they were doing and worked on COVID vaccines to get them out as quickly as possible. And we were able to enroll tens of thousands of people for each trial, hundreds of thousands of people for all the trials, to be able to understand the safety and the effectiveness of these vaccines. And really, it's the volunteers for these trials that are the true public health heroes. So for the vaccines we have available in the United States, how do they work? So we have three different vaccines, and I'll talk about them, but only two different kinds of vaccines. One of them is an RNA vaccine. Two of them are RNA vaccines. And what that means is they have a little bit of the genetic code of the spike protein for the virus. So not the whole virus. It can't give you COVID. It can't make you sick. Just enough for the RNA for the spike protein, the genetic code. It's encased in little fat bubbles called lipid spheres, lipid nanoparticles. But all it is just fat bubbles. And those little tiny fat bubbles help the RNA get to our cells. They enter our cells where they meet our protein factories or ribosomes. And the ribosomes see RNA from our cells every single day, tens of thousands of messages in each cell. And so they say, well, I know what RNA is. I know what to do with it. So it reads the RNA and makes proteins. And those proteins that the ribosomes are making are the spike proteins, which then travel to the lymph nodes and other parts of the immune system, and they trigger an immune response so that our bodies are primed, are prepared to fight the virus by creating antibodies, by creating memory B cells and memory T cells, so that when our bodies see the coronavirus, it will attack, our immune system will attack and prevent us from getting sick. The other vaccine that's available in the US is called the Johnson & Johnson or Janssen vaccine. It works a little bit differently than the RNA vaccines, but kind of a similar concept in that it's getting genetic material from the virus just for the spike protein, nothing else, into our cells, this time using an empty shell of a virus that when it's a normal virus can cause colds, but it has been altered, so it doesn't do anything but bring the genetic material to our cells. It injects it brings that into our cells. Our cells again make spike proteins, and our immune system responds by creating antibodies and T cells and memory. So it's very protective against the virus. So the vaccines that are available now are three. There are two mRNA vaccines, the Pfizer mRNA vaccine that is licensed, fully licensed for people 16 years and older, and for which an emergency use authorization is available for people 5 to 15 years. The Moderna vaccine, also an mRNA vaccine, is available to everybody 18 and older under an emergency use authorization. The Johnson & Johnson vaccine is the only adenovirus vectored vaccine that we have. That one is available under emergency use authorization for 18 and older. It is a little bit less effective than the Pfizer and the Moderna vaccine. And although all three vaccines are incredibly safe for almost everybody, the Johnson & Johnson vaccine has more very rare side effects than the Pfizer and the Moderna vaccine. And because we have safer, more effective vaccines available in the United States, the CDC's advisory group just voted today, about an hour and a half ago, to say that people should get an mRNA vaccine unless there is an important need for them to get the Johnson & Johnson vaccine. What kind of needs are there? Well, let's say you had a rare reaction to one of the mRNA vaccines, such as an allergic reaction, or a young man who may have developed inflammation of the heart after one of the mRNA vaccines, which is a very rare event, but and generally very mild, but still can be kind of scary. The CDC said that those people, if they need boosters or need other doses, should consider getting the Johnson & Johnson vaccine. Overall, these COVID vaccines are incredibly safe. There have been 480 million doses given in the United States. We know what the common side effects are, and they're generally mild to moderate, and they don't last very long. You can have pain at the injection site, headache, fatigue, muscle aches, chills, nausea, fever, or redness or rash at the injection site. Serious side effects are incredibly rare. The serious side effects differ based on the vaccine. So again, for the mRNA vaccines, the serious side effects are the incredibly rare side effects are an allergic reaction that can happen in about 1 out of every 250,000 people who get a dose of vaccine. The There's myocarditis that occurs in a few cases per million doses given to young men and adolescent boys. And usually it's very mild and short-lived. For the Johnson & Johnson vaccine, the side effects are a rare clotting event, as well as a neurological event. Again, all very, very rare. And for the majority of people who have the vaccines are incredibly safe. But because the mRNA vaccines are safer and more effective, they should be the go-to vaccine from now on. If you are vaccinated, you are less likely to be infected, less likely to be hospitalized, and less likely to die. So these are graphs from the CDC in terms of the number of infections in people who are unvaccinated versus the vaccinated. So unvaccinated, much higher levels of infection than the vaccinated people, but you do see a bump in vaccinated people because there are breakthrough cases, which we'll talk about. This is hospitalization rates, again, much, much higher in those who are unvaccinated versus vaccinated down at the bottom, with an even smaller bump in that, because the vaccines may not prevent you from getting infected, but they will prevent you from being hospitalized. And then these are the risk of death. And these are the people who are unvaccinated versus vaccinated. And again, this is in the Delta wave. So these cases all went up with the Delta wave. So in August, an unvaccinated person's had 6 times more likely to test positive for COVID and 11 times more likely to die from COVID compared to a fully vaccinated individual. And if you look at, even though it took a while to get people vaccinated, and not everybody is vaccinated yet, the COVID vaccines in the United States has made a tremendous impact on our public health already, just in the last year. So we have, there's been a 1.1 million additional COVID deaths that were averted, people whose lives were saved because of vaccination, and more than 10 million hospitalizations. And can you imagine, our hospitals are already full. I don't know what they do with 10 million additional people, and 36 million cases averted. So if we had no vaccines in the last year, we would be facing 2 million deaths total in the United States very, very soon, which I can't even begin to wrap my head around. I'm going to go on to children's vaccines. So why should we vaccinate children? We'd heard for months that children had milder disease. The disease was less severe in kids. Maybe kids didn't even get infected. Well, what we realized is that kids didn't get infected because they were kept home from school and they didn't go anywhere. But once they started going back to school and started going out, and especially with Delta, which is more infectious and more severe in kids, we saw more kids being infected, more kids being hospitalized, even little babies. As of last week, there have been over 7 million children infected with COVID. 771 children have died so far from COVID in the United States, which is a huge number. We've had almost 6,000 children develop the rare, severe multi-system inflammatory syndrome, and about a tenth of those kids have died, over 50. But now we have a vaccine available to kids 12 to 15 as of May, and 5 to 11 as of last month. And why should we vaccinate kids? If you look at the diseases that we already vaccinate kids at, and prior to those vaccinations, the number of deaths in children per year, they were really low compared to the number of deaths from COVID, even in the 5 to 11-year-olds, which is the age range where the fewest deaths in children occur. Most deaths in children occur in children under 5 and children between the ages of 12 and 18. And so even in this, the kids that are least affected by COVID, the 5 to 11-year-olds, the number of kids who've died from this in 1 year is still 3 times as high as other or more as other diseases that we already vaccinate for. Also, vaccinating children can keep them in school because if they are vaccinated and exposed to somebody with COVID, they don't have to quarantine. So it's one way to have less educational disruptions for our kids who've already suffered so much from this pandemic. As you know, last month, the CDC approved pediatric COVID vaccines for ages 5 to 11. This is a different vaccine formulation, but the exact same vaccine that is given to adults. It's just given at a lower dose. It is given 2 vaccines 3 weeks apart. This is the adult, or the purple is the adult, or that formulation are for those over the age of 12, and the orange top is that for 5 to 11-year-olds. It's a different amount of vaccine in the vials that when it's diluted, they give a different amount. So adults get 30 micrograms, kids get 10 micrograms. The reason for the lower dose is because kids have an amazing immune system and respond really, really well to the vaccine and don't need as high of a dose to get a good response. And this lower dose is safer with fewer side effects and fewer fevers in the kids. Big Bird is 6 years old. And so Big Bird got his vaccine when it became authorized. And it's a really good way to talk to kids about their vaccines if they are a little apprehensive or nervous, and say, Big Bird got it and did really well. He said, my wing is feeling a little sore, but it'll give my body an extra protective boost that keeps me and others healthy. And I think Big Bird is a fantastic messenger for teaching kids about vaccines and the importance of getting vaccinated. So why did it take so long, relatively, for us to get vaccines for kids, and why is it taking even longer for us to get vaccines for kids under 5? It's because we did things differently for these vaccines. Usually when we target vaccines in children, we only do a very small trial in adults just to make sure the vaccine is safe, because most vaccines for children, adults don't need. And then we go to a small group of older children, again, just to make sure it's safe and to figure out what the dosage will be before we go down into the youngest children, who are usually our targets for vaccination, and vaccinate them and do a large study in that age group. But because COVID primarily attacked and killed adults, especially older adults and people with coexisting disease, we prioritized adults for the vaccine, and so did a full, huge trials in adults first before we started marching down in age little by little, looking at the best dose, looking for vaccine safety, immune response, and efficacy in 16 to 17-year-olds first, then 12 to 15-year-olds, 5 to 11-year-olds, and finally, we are now looking at 6 months to 4 years old. Pfizer is currently the only vaccine available for children ages 5 to 17. We're still following everybody who participated in the trials, including the adults, for long-term safety and efficacy. And we are now doing vaccine trials, as I mentioned, for kids 6 months to 4 years of age. I'm hoping that they will get emergency use authorization for this age group early next year. It takes longer because we want to make sure that we have the right dose and to make sure that the vaccine is as safe as possible in children. I'm going to go on to third doses and boosters. So people who are immunocompromised, who have diseases that affect their ability of their immune system to respond, people with cancer, people who are on dialysis, people with transplants, don't respond as well to vaccines. So if you look at the percent of people who responded to 2 doses of mRNA COVID-19 vaccine, healthy adults, almost everybody responded. 95 to 100% of people had good antibody responses after 2 doses. People with cancer, not so much, especially people with blood cancers, which is the darker blue here. People who are in hemodialysis did pretty good, but still it dropped below that 95 to 100% and was probably somewhere around the 80% response rate, not the 95 to 100%. Transplant patients did the absolute worst, with more than half of them not responding at all to this vaccine. And then people on medicines that suppress their immune system, such as steroids, such as other drugs for rheumatoid arthritis or lupus, depending on the medicine, their responses could really vary from a very small percent to good responses. So because of this data, because we understood that 2 doses was not enough for some people, the CDC first recommended that a 3rd dose of vaccine, which can raise the antibody level significantly in people who are immunocompromised, that everybody who is moderately or significantly immunocompromised should get that 3rd dose. It is not a booster. This is a 3rd dose. And this is a 3rd dose. It can be given as close as 28 days after your 2nd dose of vaccine to get the immune response to a level that is similar to what somebody within a normal immune system will respond to. In terms of boosters, we started looking at boosters when we started seeing breakthrough cases. And what's a breakthrough case? A breakthrough case is somebody who has COVID-19 infection after they've been fully vaccinated. And fully vaccinated still means 2 weeks after your 2nd dose of either Pfizer or Moderna, or your 1st dose of the Johnson & Johnson vaccine. We did expect to see some breakthrough cases. We know that no vaccine is 100% against infection, but most people who are vaccinated are protected against more severe disease and hospitalizations. We know that the symptoms of people who with breakthrough infections appear to be milder than people who are unvaccinated. They're less severe and of shorter duration. But people who get breakthrough case infections can be contagious and can spread the infection to other people. Having said that, most people who are hospitalized, still more than 90%, are unvaccinated people, or people who have severe immunocompromise, or their immune system just doesn't work very well. And so, but what we're seeing now, especially with Omicron, is more and more infections in people who are fully vaccinated. And because of that, the FDA has authorized booster doses for all people 16 years of age and older. And the CDC director has recommended that all adults should get a booster dose when they are 6 months out or more. So when should you get a booster dose? If you originally got Johnson & Johnson, you should get a booster 2 months after your 1st dose, because we know that the effectiveness of that vaccine is not as good as the other vaccines. If you got the Pfizer vaccine or the Moderna vaccine, you get your booster 6 months later. Pfizer for everybody over 16, Moderna, everybody over 18. The Johnson & Johnson and the Pfizer vaccine that's given as a booster is the same dose that was given originally. The Moderna vaccine, they're only giving half of the dose because that seems to be enough to give a good immune response. I think this is my last special topic, is vaccinations and pregnancy. Millions of pregnant women have been vaccinated against COVID very safely. There's no known increased risk from a safety perspective to pregnant women or breastfeeding women. The CDC recommends that all pregnant people be vaccinated against COVID. The vaccines will protect the woman, but also protect her fetus. The pregnant women who get the vaccine are being followed by VSafe, which is the CDC's vaccine safety monitoring system, and they've not found no safety signals so far. And we know that these vaccines have no effects on fertility, so they have no effect on the woman's ability to get pregnant afterwards. We've had plenty of people who've gotten pregnant and had no problems getting pregnant after they've been vaccinated. We do know that COVID is really bad in pregnant women. if they are unvaccinated. So especially with the Delta surge that has happened in the summer and the fall, we're seeing increasing numbers of unvaccinated pregnant women dying after COVID infections. All women of reproductive age do worse with COVID than younger women or men of the same age, but especially pregnant women. They're 60% more likely to be hospitalized than a non-pregnant woman. They are 60% more likely to end up in the ICU, and they're twice as likely to die of COVID than a non-pregnant woman. And pregnant women who are unvaccinated are much more likely to have stillbirths or miscarriages than vaccinated pregnant women. So COVID protects the mom, and it protects the COVID vaccine, protect the mom and the fetus in case they get infected. And also the antibodies that the mom makes when she's pregnant and vaccinated can cross over to the baby and protect the baby for the first few months of life. So really important to get vaccinated if you're pregnant. And then finally, staying safe and looking ahead for the holidays. I think everybody was looking forward to having a more normal holiday season this year. I certainly was very excited. And I think Omicron has really put a damper on that somewhat. But one thing to remember is that it is flu season, and influenza is increasing rapidly, just like COVID right now. So get your flu shot. There's even more reasons than ever to get your flu shot this year. It's to prevent symptoms that can be confused for COVID, to prevent doctor's office visits and hospitalizations when the health system is already very stressed. We don't need a twin pandemic or twin epidemic of flu and COVID. One is enough. Thank you very much. You can get your influenza vaccine anytime. You can even get your flu vaccine and your COVID vaccines together. And don't forget other routine vaccinations and routine healthcare. What we're seeing in the hospitals are that people are neglecting their mammograms and other routine healthcare. And so they're coming in with more advanced disease that could have been caught earlier. And then finally, staying safe is a multi-layered process. You can think of it like Swiss cheese, where all the pieces of the cheese have holes and the virus is trying to get through a whole bunch of layers of Swiss cheese. It might find holes through a couple of the layers, but if you keep piling on layers to protect yourself and others, eventually the virus will not be able to get past. The layer with the fewest holes, the most effective layer is the vaccine layer. So it's really important to get your vaccine and to get your booster if you're eligible. But we know other layers work really well as well, such as masks, staying outdoors, making sure that ventilation is improved and you're in a well-ventilated space, avoiding spending a lot of time in crowded indoor spaces, especially with poor ventilation. If you are sick, stay home and get tested. Don't go to work. Don't see other people. Don't expose them until you know for sure that you don't have COVID. And test frequently just to make sure that you're doing well and that you aren't exposing other people. And just to remind that COVID continues to be a very serious virus. It changes on a dime, and it can cause severe complications and death in the most vulnerable populations, especially, but that it's the unvaccinated people that are filling up the hospitals. And so the best way to protect yourself and those around you is to get everybody who is eligible for vaccines vaccinated. And I will end there, and that's all my contact information. Emily, are there questions?
Yes, thank you so much, Dr. Talaat. This was, I think, very, very helpful for everyone that has joined us. We do have a couple of questions. Desiree will actually go ahead and bring those questions to you.
Yes, good evening. So Dr. Talaat, a question was asked. I've read that children have developed heart problems after being vaccinated. I'm hesitant to have my 10-year-old vaccinated. I'm not against it. What are your thoughts about this? Thank you.
I'm going to show a different slide. So I think that the heart risk from COVID is so much higher than the heart risk from the vaccines. And so it is very important to get kids vaccinated. I have a 10-year-old boy and I got him vaccinated. I vaccinated my 14-year-old nephew for the same reason. I am going to show, let me end, oh dear, let me try this. Let me end this slide. Did I stop sharing?
Yeah.
I did. Okay, so let me find the right. I like pictures. I think pictures are very helpful. So let me see if I can pull this picture up. Okay.
While we're waiting for Dr. Talaat to
got
get
it.
that up, if you have any other questions, please place them in the chat and I'll be sure to share them.
So this is a slide from a study that was just published in the UK about the risk of heart disease. And you can see here in red, the risk of heart disease from COVID and the number of cases. The risk of heart disease in orange from the Moderna vaccine in young people, which is not authorized in the United States for teenagers. And then the risk of heart disease from the Pfizer vaccine. And the risk from COVID is more than twice the risk from the Pfizer vaccine. What we also know is that the risk of myocarditis after vaccination is generally very, very mild. People recover much faster after vaccination than after disease. It takes a much longer time to recover after disease. And so from a heart perspective, the best way to protect your child's heart is to actually vaccinate them.
Thank you. The next question is, it's now being said that 2 doses of the vaccine is not enough to protect us from the Omicron variant. We need a booster dose. There are only 2 doses for children so far. Are they protected enough with that because there is no booster for them as of yet?
It's a really good question, and we don't know the answer to that. We do know that children make much better immune responses to the vaccine than adults. So I'm hoping that the 2 doses for children is enough to protect them. We also know that children tend to be less vulnerable to severe disease. So even if they get infections after they're vaccinated, that should protect them from being hospitalized or becoming severely ill. So until we have the booster data for children, getting them vaccinated with the 2 doses is the most important.
Thank you. The next question, my children 5 and 10 years old got their first COVID vaccine and are due for the second shot on December 21st. Is the dose the same? The only reaction they had was, I'm sorry, okay. The only reaction they had was a sore arm. Should I expect the same for the second dose?
Yes, because it's giving a lower dose, most kids do much better after the second dose compared to us grown-ups. I know after my second dose, I was laid out for a day. My teenager was laid out for a day, but my 10-year-old had no problems. He was a little bit more tired the day after his second dose, but otherwise really very few symptoms. Desiree, there's a bunch of questions in the chat.
Yes, I see. I'm getting to those now. Okay, so what's the major cause behind those higher infections in non-white population?
Racism. We live in an incredibly racist society, and people of color have been for years marginalized, not given the same educational benefits, not given the same housing and not given the same access to healthcare as Caucasian Americans. And as a result, they tend to work in jobs that require them to be out in the community, facing forward, public facing, as opposed to being able to telework from home. They are more likely to have comorbidities that put them at increased risk for severe disease. They are more likely to have to live in more crowded and multi-generational households that put people at increased risk for infection and transmission.
Next question. So should people with transplant not get the shot if they did not respond well?
No, they should get the shot, absolutely, because the third dose does seem to improve the responses in even people with transplant. The other thing is, if you have a transplant, you should talk to your doctor, because just last week there was a new approval for the monoclonal antibodies, which we are using to treat COVID. It's now approved to be used as a preventive medicine and preventive therapy in people who are at high risk because they are severely immunocompromised and so are not going to respond as well to vaccine. So you should still get that third dose. You should get the booster when it's recommended to you, but you should also talk to your doctor about whether your risk is high enough that you need to take that monoclonal antibody. And you should also encourage everybody you come into contact with to be vaccinated, including your children, because that will help protect you.
Thank you. Does the fetus have any antibody against the COVID of the mom? Does the fetus have an antibody against the COVID of the mom, I guess, who was vaccinated?
Yes. Yeah. So if a woman is vaccinated during her pregnancy, her antibody levels go up really high, and that will cross the placenta, not the vaccine. The vaccine won't go across the placenta, but her antibodies will cross the placenta and protect the fetus. And they last for a few months after the baby's born. And so it will protect the baby for the first few months of life as well. And that's why we vaccinate pregnant women against other diseases such as a flu vaccine, and why we vaccinate pregnant women against the tetanus pertussis vaccine, because the babies are very vulnerable to flu and pertussis. And we know that we can protect them for the first few months of life by vaccinating their moms.
Okay. The next question was, is the booster shot available to all ages or just high risk?
The booster shot is available to everybody 16 years of age and older, regardless of risk.
And you have a comment here. Thank you so much, Dr. Talaat. The information is helpful and great.
You're very welcome. It's my pleasure.
Let's see. I'm due this month for booster. Do I have to go date by date to date?
Oh, no, you can go anytime after the 6 months. Anytime after you are due.
This person comments, I do not do good with the flu shot, so I'm not sure I should get the COVID shot.
They're really different vaccines. And so people who react to the flu shot don't generally react to the COVID vaccine, and vice versa. They're very, very different. What I would recommend is, if you have a lot, like I felt horrible after my second dose, not quite so bad after my booster. But if you, there's probably slightly lower side effects from the Pfizer vaccine, because the Moderna vaccine is a little bit of a higher dose. So if you're sensitive, you might want to go for the Pfizer. The Moderna might have a little bit more efficacy.
A comment. Thank you so much for the clarification on everything. You said it gave me more strength. Another question, where can the kids get the COVID vaccine?
Great question. So a lot of pediatricians have it. So if you have, a lot of health departments are running clinics in school. So a lot of school, like they'll run clinics after school and on weekends for parents. So we've been getting notices from my kids' schools about vaccination clinics. CVS, Walgreens, Giant, all will give, anybody who's giving vaccines will give kids the vaccines. There have been special clinics all over Baltimore. If you live in Baltimore, the Hopkins mobile van there's been every Friday night at Sacred Heart of Jesus Church in in Baltimore. I mean, there's so many places to get vaccines. So if you go to marylandvax.gov and put in your zip code, it'll give you options for, let me find the website and I'll put it in the chat.
And I can look in there as well. Last question, will there be any fourth dose for the new variant that just came out after we took the third dose?
So it's marylandvax.org. There probably will be, but it will be months. And Omicron is here, and I would get the booster now and get that booster when it's available.
Okay, 2 more comments and then we'll move forward. I got a very bad infection after both shots of Moderna, and I'm afraid of the booster.
What kind of infection? Sorry, that's usually you shouldn't get infections after vaccines. If you had reactions, maybe. I have to tell you, I had a terrible reaction after my second dose. I felt really tired. My arm hurt. I could barely move it. I had a red rash on my arm. I had a fever. I had chills. It lasted about a day, and then I was better the next day. And now I'm protected. You should not have infections or antibiotics after the vaccines. So I don't, my email, I'm going to put my slides back up, my email, my phone number, back up so that you can contact me privately. So you don't have to share your medical history.
Okay, and last week, let me go back up. It was right before your comment. I had a lot of itches, someone described after the vaccine.
Itching alone is not a contraindication. If you had a severe allergic reaction, then you should talk to your doctor about what vaccine you should get. But itching alone is not a contraindication to getting a vaccine.
Thank you. I think that concludes all of our questions.
There's no contraindication for a child getting who's taking any medication. They can get the vaccine.
So there is one more question. Any idea if there's going to be a fourth dose since the new variant came out, or are we going to just stick to 3?
There will probably be a fourth dose, but it will be months away. And so I would get the booster dose now because Omicron's here and it's your best way to protect yourself.
Very good. So lots of thank yous, Dr. Talaat, in the comments. So I think, again, everyone appreciates your time and the information. Lots of good information that you shared. I would like to also just share some announcements on behalf of Priority Partners. So if I can, yes, thank you. So just before, so everyone, again, thank you so much for attending tonight's webinar. I want to just take this opportunity, since you're here, to just share a couple of announcements about Priority Partners. During the early beginning of the pandemic, many individuals had access to healthcare, and the Maryland Health Connection, the state of Maryland, really wasn't worried too much about eligibility requirements. But that has now changed, and since we are ending the public health emergency, we need everyone, because we don't want anyone to be without benefits. So we urge you to please make sure that you update all your demographic information, your income information on your Maryland Health Connection account. And you can do that by going online to marylandhealthconnection.gov or by calling over the phone and making sure that all your information is up to date. Because the state, it will start going through different accounts and verifying that everyone continues to be eligible. And so again, we don't want you to lose your benefits. If you ever have any questions, please feel free to always call Priority Partners as well, and we will help you. We'll be glad to help you. And also in the realm of the vaccine, you may have heard, you may have not, but the state of Maryland is also offering a $100 gift card for those who have not gotten vaccinated and they get vaccinated. So if you have not received your COVID vaccine and you get vaccinated, make an appointment, let's say tomorrow morning, you go on the website that Dr. Talaat has shared on the chat, or you contact us through Party Partners, and we can help you locate where you can get vaccinated. But if you get vaccinated, we will send you a gift card. You will get a gift card of $100, and it is for those 16 and older. So it's not for the children, it's for the adults as well. And then, of course, so basically you get, basically you get the vaccine. Excuse me, it's for 12 and older, not 16 and older, 12 and older. So you get the vaccine. It's between the 15th of December, so as of yesterday, up until March 31st. If you get the vaccine during this time period, then you will be eligible for your gift card. Again, here is the website where you can go and put in your zip code, like Dr. Talaat said, and you can find the location. You can also call us, and we can help you locate a place to get your vaccine. And then, of course, lastly, we do have 3 winners for tonight's participation. So what we just did is we randomly picked attendee number 10, attendee number 20, and attendee number 30. And so if you see your name, we will be contacting you via email just to verify a mailing address and get you that gift card. So once again, thank you very much for attending this evening's webinar. Please feel free to call us, Priority Partners, should you have any questions regarding benefits, where you can get your vaccine, whether you need to renew your benefits. If you have questions, we are available to you to answer any questions. But thank you so much for attending tonight's webinar. And I do see a question, do boosters count? No, it's for those who just get their vaccine for the very first time. So it's only for that first dose that individuals get the vaccine. So yes.
That would be first and second dose if it's Pfizer or Moderna, and if it's Johnson & Johnson, the single dose would be considered fully vaccinated.
So again, thank you so much for joining us, and hopefully we will see you at future webinars. If this is your first webinar attending that Priority Partners is offering, we encourage you to visit our website, go under community events, and every month we host 2 to 3 webinars on different health-related topics that is open to members as well as non-members. So we encourage you to please visit our website, learn about all the good things Priority Partners is offering, as well as future webinars that you may benefit from. So thank you very much, and wishing everyone the happy holidays. Thank you so much.
Good night.